Have you ever heard of adenoids? They're these tiny hidden parts of our body that most of us never think about until they start causing problems. So, what exactly are they? Adenoids are small patches of tissue located way up high at the back of your throat, just behind your nose. You actually can't see them just by opening your mouth and saying eh. Think of them as your body's personal bodyguards. They're part of your immune system, and their job is to trap germs like bacteria and viruses that you breathe in. They're made of the same stuff as your tonsils, and you can think of them as partners in defense. Now, what's really interesting is that adenoids are most active in young children, especially between ages 3 and 7. This is when kids are exposed to tons of new germs at daycare or school, so their immune systems are working overtime. But as we get older, our immune system gets smarter, and the adenoids naturally shrink and often disappear by the time we're teenagers. For most adults, they're so small, they don't cause any issues at all. However, in some children and even a few adults, they can become enlarged or infected, and that's when things like breathing difficulties and snoring start to show up. So, why do adenoids swell up in the first place? Well, imagine those little bodyguards are constantly under attack. Eventually, they get tired, inflamed, and swollen. The most common reason is frequent infections, like colds, the flu, or throat infections. Every time you get sick, your adenoids jump into action. If you get sick too often, they just stay enlarged. Another big culprit is allergies. Things like dust, pollen, and even city pollution or cigarette smoke can irritate the adenoids and make them swell, even without an infection. Sometimes, stubborn bacteria can get trapped in the tissue, causing chronic inflammation that leads to ear or sinus infections. In short, repeated infections, allergies, and poor air quality are the main reasons adenoids get enlarged. And when that happens, the airways can get blocked, causing that dreaded mouth breathing and snoring. When adenoids do get swollen, the signs can be pretty clear, but some are easy to miss. The number one sign is mouth breathing. Because the nose is blocked, people, especially kids, start breathing through their mouths all the time. You might notice your child's mouth is always slightly open. Next up is snoring or noisy breathing during sleep. With a blocked airway, breathing at night gets loud. Some children might even stop breathing for a few seconds, which is a condition called sleep apnea. This leads to restless nights and waking up tired. You might also notice a nasal-sounding voice, almost like they're talking with their nose plugged. Because adenoids are so close to the tubes connecting the nose and ears, swelling can block them, trapping fluid and causing frequent ear infections or muffled hearing. A constant runny or stuffy nose that just won't go away, even without a cold, is another classic sign. If you see these symptoms, mouth breathing, snoring, and constant ear infections, it might be more than just another cold. The adenoids could be the real problem. So, how do doctors figure this out? It's actually a pretty straightforward process. First, your doctor will ask about your child's symptoms. Do they snore, breathe through their mouth, get a lot of ear infections? This helps them see a pattern. Then comes a physical exam. While they can't see the adenoids directly, they can spot clues like swollen tonsils or fluid in the ears. For a definitive look, an NNT specialist might use a tiny, flexible camera called an endoscope. It's gently inserted through the nose to get a clear view of the adenoids on a screen. It's quick, safe, and provides a clear answer. Sometimes, a simple X-ray can also show how big the adenoids are and if they're blocking the airway. Once enlarged adenoids are confirmed, what's the next step? The good news is, there are several options. If the swelling isn't too severe, doctors often start with medications. This could be antibiotics if there's a bacterial infection, or nasal sprays and antihistamines to reduce inflammation, especially if allergies are the cause. Simple home care, like using a humidifier and keeping the air clean, can also make a big difference. But in more serious cases, like with severe sleep apnea or constant infections, a doctor might recommend an adenoidectomy. That's the surgical removal of the adenoids. It sounds scary, but it's a very common, safe procedure. It's done through the mouth with no cuts on the outside, and kids usually go home the same day. Recovery is quick, and most children start breathing easier and sleeping better almost immediately. So, how can you help prevent these issues from starting? First, good hygiene is key. Frequent hand washing helps cut down on infections. Try to keep your home smoke-free and the air as clean as possible to avoid irritation. Gently clearing the nasal passages with a saline spray can also help. And of course, a healthy diet and enough sleep will boost the immune system naturally. It's also really important to encourage nose breathing whenever possible, as mouth breathing can make things worse over time. To wrap it all up, adenoids are our tiny immune system guardians, especially during childhood. When they get swollen, they can cause breathing issues, snoring, and infections. But whether it's through simple home care, medication, or a quick surgery, there are effective ways to solve the problem. Remember, if you notice any persistent symptoms in your child, don't just wait it out. A visit to the doctor can make a world of difference. If you found this video helpful, please give it a thumbs up and share it with any friends or parents who might need to see it. And don't forget to subscribe for more easy-to-understand health tips every week. Thanks for watching, And here's to healthier breathing for you and your family.